Hello there, welcome to new session with your program East Visions, and I hope you enjoy your time the last period of time. As I say, prevention is better than cure. When you find a community with well-being, for sure, that will directly affect on their lifestyles. People can be more productive and more active and enjoy their lifestyle. Any nation care about health and concern how to make it better, it will be very strong and very happy. So today we're going to talk about a very, very interesting topic. We're going to talk about the education and health education and also in the healthcare and how that can be play very essential role in our life. Welcome back, and let's have this break and get back again. Well, welcome back again, and it's my pleasure to give you a very dear guest inside the studio. I give you Dr. Muhammad Hamad Balla. Welcome to the show, and thank you for joining me.
Thank you very much. I'm happy to be here.
Thanks a lot. I believe talk about health education is something very essential, and it is play very, very, very strong role. So, as a term, what does it mean, health education?
Health education as a term compromise a wide range of meaning, but in this case we talk about educating the people about the health, what's bad, what's good for them in their life, and its main purpose is to change the habit of the people about and the style of their living, to promote them to be to lead a healthy lifestyle and a healthy way of living. Prevent, of course, that including preventive disease as to change the lifestyle of living. There is many, of course, conflict definition, but WHO, which World Health Organization, usually define health education as the principle of educating group, individual, and community with the skill and information of health, about the health of their living, and to direct that toward their community and toward their life. And it include many health aspects of the health, as I said, which include environmental health, spiritual health, psychological health, and the main say of it, which is the health of their body and mind. So health education is a very important part of our life, and it compromises, as I say, very wide range, but it is also come to the one and most important thing, which is self-education of the individual to themselves and to the community.
And that is, lead me to the next question. What the importance of health education? Why people should be more keen in it?
Importance of health education. If we could say that, talk about it on general aspect, we could say differentiate between nation on their political system, on their economical system. One of the main things that is differentiated is the health standard in any nation, and the health level of any nation. So to give example, Japan has a lifespan of 80 years for female, 79 for male. Sudan, unfortunately, have 67 for male, and for female, 65 for male. Health education here is at the core of any health system. It's the principle at which we educate all members of community to participate in the health promotion in their community, in their neighborhood. And so health system cannot sustain itself and cannot promote health without any cooperation from the environment and the community upon which is live and upon which is service.
Well, you know, that means it's just like a message being delivered to the other people and different kind of people in order to just try to participate in this point. All right. To make some action takes place here, what the method and the ways that should be followed in order, to improve this track?
The method usually is compromises any type of communication between human, like the old method we have, which is radio, newspaper, and journal, and of course the new method which we have, which is we could say in the internet, Facebook and Twitter and other type of social media. Uh, of course, promoting this method does not only using this method does not only guarantee a good health education. This method should be utilized in a way to be attractive for the community member and to encourage participation from the community in this method and in this type of social media, because this social media is not a broadcasting type which is have been used like television and radio, but it is a participatory one in which the community of this type social like Facebook and Twitter and YouTube work a vital role in spreading it and in using it and it making it very effective or not very effective, and that's according to the utilization of the source of the health educator profession.
You know, this is also depends on the nature of the community. Actually, you know, community is different from one to the other. Maybe for sure, the social networking sites play essential role in spreading out any kind of idea or any kind of ideology. But that depends basically on people who deal with these things. I believe health education is quite important, related to to spread it out. But in Sudan here, you know, not majority of people using this kind of communication. Yes. So let's be more specific and just try to reflect the reality here, the methods, the specific methods that you know could be very effective in spread out the education. Which one that should be used in Sudan?
In Sudan here, of course, as you mentioned, social media is not widespread. We have a large rural area. The best method is, and we have been using, is sending convey of health professional, which is being used by universities to rural residents to send health education for 2 weeks, 3 weeks, 1 month, and staying in the rural area and give courses and education program for the population there. We could say that's the main essay, but of course it's resource intensive. You need of course the time, the educated large staff, educated professional, and so it is kind of hard and kind of need large, as I said, resources. Also, we could utilize in our community its nature, which is we are a very cohesive community. Could have, as I say, religious leader and what we could say a religious leader of the community to promote the health education and to make it appeal for the community, and any convey, as my experience to say, that does not when it reaches a certain type of community does not address or does not pay respect for the community leader, it usually fails to deliver its message because people does not listen for it or consider it disrespecting for its tradition, which is also very important. Of course, our community is, as I said, rural in large, so it has a many large tradition, some of it good and some of it not very good, and addressing the not very good tradition need a certain kind of skill. Unfortunately, it's now lacking some in our professional medical staff, but we hope in the future we can address this point and health professionals become more educated about it.
Well, that's gonna be awesome, because really that you know, affecting people in very good way. Well, when talk about health education and different categories and different kind of education, or I mean in health in general, you know, just jumping in mind, you know, okay, this is a responsibility of the government that, you know, presented by the Federal Ministry of Health. So, from your position, is there any organization also takes place in promoting the education or health education?
It's essential, especially in our country, to know that we are a limited resource country. Of course, neglecting the political side of it, as a country, we do not have many range of drug available or resources available for the health system to provide a proper health system. And so here, community organization become vital important for promotion and to reduce the gap of health between what should the health system be and what the government can provide. And community and of course international organization provide of course much needed help in this area. But of course even community and government cannot do much help. We need individual awareness of the health themselves, about health of community, and this need to be by every member of community, and it cannot not done by group, done by a single organization, and it need to be a wide community at large to participate in this type of promotion of health and health education at general.
Well, what about the other organization here? You mentioned just when we take a look at the situation of health in general here in Kassala, you can figure out easily there is many NGOs, international non-governmental organizations, working here and also participate in health, just try to improve it. It's just like collaboration with the local authority and those organizations. So what about the other organization? I'm talking the civil community organization societies. Also, don't you think they have also role should be played in this point?
They actually are the main role, of course, in civil, because they are the most closely related to the community in case of culture, of tradition.
For such a reason, yeah.
Yes, and so they are the most able to understand what the community needs. But of course, the problem, as I say, is resource, which unfortunately there is many talented medical profession. Unfortunately, there is less.
Why the problem? Why there is a lack of? I'm sorry for interrupting you, but there is many medical schools. They graduate many, 1,000 of graduate in this field, as a worker in health education. So the lack of resource is it in other kind of resource or in professional, or the material that for training of this? Where can found this lacking in this resource?
As I said, there is a political side of the problem, which is considered with the blocking that the international blocking have in Sudan. There is certain type of medical equipment, medical drugs we cannot have in Sudan, and of course there is a certain type of what you could say international education for Sudan, medical staff that usually third world country could have, but Sudan unfortunately cannot participate in it. But there is also, and I want to say this as very important thing, is mismanagement of our resources in Sudan. Many hospitals have large quantities of resources. Unfortunately, they don't know what to do it and squander it in some, you could say, useless activity instead of doing it in the right way. And this does not come usually from what you could say a malice, that someone intended to do that, but usually from some type of blindness in research, which I want to, I hope we could address.
Okay, that's very interesting, and I believe we receive a phone call. The control give us that sign. Hello? Hello?
Hello, hello.
Hi, how are you?
Hi, fine.
Miss Arwa Al-Tayyib, thank you for joining me. And today we talk about the education and how important is it. So what do you think about it?
Okay, in fact, health education is very important issue. I can say it's the center of all elements of healthcare, especially in countries that suffer from problematic social services, such as Sudan and Eastern Sudan, of course. I think it's a part of their work of medical staff and also people who have some of health information.
Mm-hmm.
Here in Kassala, we need to spread health awareness among health people and patients by both.
Mm-hmm.
And this will be done through health education,
Mm-hmm.
definitely. So finally, I hope all viewers of this useful program shared their health information with others to
Mm-hmm.
be health society, live in a health environment.
Thank you very much indeed, Arwa, for taking part the program. Really, it is so appreciated. And see you next time in very health way.
Okay, thank you,
Thank
thank
you.
you.
Thank you. Uh, well, also this is just about what you said before. The health education. It should different kind of people should feel more responsibility and carry in order to improve it because a health nation that's mean a very strong and very happy nation.
Yes.
Okay, let's go to the other question. Many questions is still boiling down because really
Yeah.
it's so very important topic to talk about. How do you estimate the health services system in Kassala? I believe you've been working in many locations, so you are here in Kassala working in Kassala Hospital. So how you can estimate the evaluate the health services system here?
In short term, I could say good, but could be better.
Mm-hmm.
Of course, any health system should be in drawing in triangle with the base of it consist of primary health care, which is the major sector of it, and it receive the patient usually, and at the top should be the specialized center, which usually here is hospital, and that's why in Kassala we have hospital 10 and primary health care is usually 89. So it's of course vitally important, but I say it's a problem of a nation at large that it is the lacking of certain type of medication, the lacking of certain type of equipment. But usually, what is needed to diagnose a disease, usually in Kassala is provided from laboratory to advanced scanning system like CT and X-rays, all provided here in Kassala. The problem comes then with management of this equipment and advancing it and evaluate it to become better and better, which is of course is management in everywhere is the problem of management. But as availability, it is here in Kassala, and soon I think Kassala will not need. After some improvement, of course, in many aspects of it, it will be even better and better, hopefully, in the future. Of course, I want to address this problem, any health system, when it's being built from hospital to primary health care, it must address, of course, the overcrowding problem and to estimate what usually is the number of community is going to be in the future. And I think 10 hospitals, the system is still very small for the population of Kassala, and even Kassala are service not only the population but its neighborhood, which is Eritrea and Ethiopia. There is patient come from this country to Kassala seeking medical health. So this problem, I think, should be put in mind when evaluating and promoting the building for the future of the health system in Kassala.
The health system is just, as a part of the jigsaw, this kind of picture, which consists of many pieces. They come together to give one picture.
Yes.
Nowadays, Kassala are going very well in development from different sides. There is many tourism opportunity, like a foreign investment come down here in Kassala, and really that for sure some improvement should be touched in different sides of health services system here. Many questions, doctor. Really, we need to, to just clarify.
Mm.
Well, in general, I believe that you're working in different places, not just here in Kassala.
Yes.
So how does usually the whole system is being evaluated here?
Usually, the main tool, of course, is statistical data report, which is research doing at large, and data being collected from health center, primary health care, from health professional, being collected, being a result being drawn out from this research, and uh, decision being made. And I want here to pinpoint that this is, I think, the main problem in our country. There is what we call the audit circle, which is a non-international, in which the research and data being collected from the field, result being produced, and decision being made according to this result. And after time, then the process being done again, and which is like a circle being done until which is resulting in the whole field and the whole system being promoted up and up. And this is what usually you could say what being called the first world is being done. In Sudan, of course, this is our first problem, that many resources being put without done a proper research in this type of thing, and this and that result in a squandering of resources without much result. Another area that unfortunately cannot be seen because not a proper research has been done to address it and to shed light on it, have resulted in, of course, so much resources being lost on that. Hopefully, in the future, these problems are being addressed and being repaired.
That's very nice. We have, to find some solution for this problem as soon as possible.
Yes.
Well, also in a link with the same question, here in front of me in this desk, we have some statistical data that reported by Federal Ministry of Health.
Yes.
Here is give us a picture about the numbers of the health institutions. Here, for sure, this is in different states because this is a federal. Here in Kassala, a hospital, we have 10. There
Yes.
is a 10
There
hospitals.
is 10 hospital. Of course, this hospital, we need to know that they are not all general. Some of it are specialized. Yes. Some of it only specialized in ops and gyna, which is delivery, and other specialized in surgery, other specialized in the pediatric medicine. There is an urban 37,
Yeah, the
rural
urban
23.
Yeah.
The most important also are primary health care 89, dispensary 94, which is the most important part because this is the one that usually the main community reach for it, because of hospital usually is big and large and equipped with large medical supply and large equipment, and it usually put in the center, and so in the periphery you don't the community and the individual cannot reach for the center. So if someone was have a mild disease, who could reach a primary health center and receive medication without taking the trouble to travel a large distance of time to reach large distance of space to reach a hospital, which is of course shorten a lot of effort and money that can be done. Of course, we have here also in the statistical the functioning and the unfunctioning.
Yeah, this is a primary health center. Function, that means it is already currently it works
Working.
and receiving many patient from the other.
Unfunctioning usually because of it's not equipped, or there is no staff to fill the hospital.
Right.
But I think the number are very good right now, and hopefully it will become even better.
Okay, what about the primary health centers? And I believe this is essential what we talk about here. From here, people can receive a services of health education and promoting
Yes.
this point. What about this number? Here,
Primary
function we
health.
have 98, and unfunction we have 10 here.
Of course, primary health care and dispensaries usually, and this type of picture we have here is usually give us a picture about a health system, which is the place you go and take medication. Health education is being done at that place, of course, but hopefully that's being done also in the community, in the neighborhood, and in the inner city, rural area, and urban area. And it being done also, primary health center, as you said, is also the first line of health education, and it always should be equipped with a department specialized in health education that are promote different type of specialized health, if we could say, health of the mother, pregnant lady, health of the diabetic patient, or the patient who have a high blood pressure. Those patients need to be addressed specifically, and it need to be also primary health care should be also equipped with this kind of health educator and health professional.
Okay, just let's sharing you the imagination. If all this functioning number of the hospital and also the health center in urban rural in different places, how that can be affects and give profound effect on people's life when you can find in any one of these health institution there is a health education section is activated. How that can affect on people. We need to have this picture in order just to give very nice feature.
Of course, it will be a very bright picture if we have all these center and institution being activated to its full ability. But as I said, it's a dialogue between community and between health system. If the health system was equipped with the professional, the skillful staff we have, it will attract many people. It will result in profound effect on the community now and in the future. Because if we want to take health education, we could talk about preventive and management. Preventive health education is the mainstay of any system that want to advance in the. We have a higher level of health standard because it empower individual with the knowledge about their about the disease, about the illness, about the way how to fight it and how to prevent it and how to protect themselves, their family and their community from it. So it is hopefully, and we say hopefully, that in the future we have this kind, we have the system being to its full ability, but as I said, it's a challenge.
Yeah, this is need, to double the effort in order to improve it. The well-known stage, prevention is better than cure, because prevention it is less costly in comparison with the treatment.
Of course.
Yeah. Well, we still have many questions, but in this space we can allocate it for people who contact us via the site of the program, within the Facebook, Twitter. And really thank you very much indeed for your participation, your comment. Really, it is so interesting. Even there is many ideas come down to us in order to improve the program, and we just try to do the best that we have. And actually, we cannot do that without your ideas. And really, I would like to thank many people who give us likes and give us comment, and even from different countries, from here, from Sudan, from Saudi Arabia, and also from Ethiopia and India. We have many friends from there, and really they like the program and about the ideas, and also support us because this is 1 in a million, and this is the first program just try to create a bridge between Sudan and the other world by using an English. And really we have a special greeting that to people from Khartoum, 25 according to this is our farm from there, and also from Kassala. Actually Kassala is very nice, and its people very nice, and also from Riyadh, and from Omdurman, particularly Wat Madani Gadarif, and also from India, from Tamil, Jeddah. Those people really they contact us, and it was very nice communication, and do not stop any single idea that come to us. Really, it's so helpful and so appreciated. Doctor, really it's something concern really the health education, because when we improve it, that means we can avoid many problems for taking place. So from your position, let's think about the statistical cases here. So from your position as a doctor in different locations and different hospitals that you work, very nice career, it's so nice. So how many cases do you receive that has related to the health education?
Of course, as I said, health education could be divided to preventive health education and management. Doctors usually have the management side of it. They are usually concerned with it as first part. Of course, preventive come. Then, so if a patient usually come, any patient I receive, I should address preventive and management. Any disease, almost all disease, actually all disease have always health education as part of it. There is the drug and the treatment, of course, and there is, of course, the change of lifestyle, habit, diet, of course, especially with chronic disease, majorly as like diabetes or hypertension. Preventive medicine come as to prevent any complication that come from these diseases, especially with, as I said, changing the diet and the habit. So, as a doctor, it's the main and the core of my professional that health education. Even when I talk to the patient that don't drink this, don't eat that, more have a balanced diet, is usually as come in the term or in the dialogue about health education. But as I said, for doctors, its management come before preventive, although preventive is the soul, or you could say the golden cup of medicine. If you could prevent individual from getting sick, you actually made huge, of course, you made a huge effort, and you alleviated a lot of problem for everybody.
Okay, let's stop you at this point and we'll return back. I think we will we receive a phone call. Hello?
Hello?
How are you?
Hello? Fine, Allah.
Dr. Mubashir, how are you, sir?
Fine, Allah.
We talk about, today we talk about the health education, and I believe that you are a student at the medical school. So just I want to scratch your mind. What do you think about the importance about health education?
I think health education is very important to our community, especially the outskirts, the countries far away from the town. It's very important. Health awareness must study to outskirts because it's missed there. They need it. They need all this health education. This is most important, and also the town needs this health education.
So you believe people should come and they should understand the importance of the health education. So you are, as a person or also as a student that you still study, do you practice any kind of health education to your friends or to the family? Do you practice any kind of these activities?
Actually, we began a program to the outskirts special.
Okay.
Conveys awareness, awareness courses to that community, and band 8 courses. Yeah, we begin all these programs.
Okay. Do you have a friend who also support you in this idea by?
Yeah. We are the group. We decided to begin this program to begin these courses.
Okay.
And after we finished, we began to teach these courses. As I said to you already, outskirts and maybe the schools, we go to many schools, give them courses about this, how to
Okay. Do you use a specific way? I mean, what the ways and what the methods that you use to send the ideas of health education to the guys or to the targeted people? Do you use a specific way in your activities?
yeah, of course.
Mm-hmm.
We use the we took all firstly we took all the when we're beginning the band A the band aid,
Mm-hmm.
we took slides and things like this and go to the school or wherever,
Okay.
wherever, and talking to them about the health awareness and how to get healthy, to get healthy community, something like this.
Oh, that's very interesting.
Very
Really,
good.
it is very nice idea. Well, I believe that you are lucky guy here because we have very professional, I guess, insight. I think Dr. Mubashir is still a student in the medical school. Do you have any advice for him for better and better?
Well, of course, first, I hope for the doctor all the fortune. In medical field, you need always to equip yourself with the latest information, with the
Okay.
latest technique in the medical health, and of course, hopefully, and I hope, and from what I hear, he's a very good and very working hard doctor, and will be a very good assets for the health system in Sudan.
Thank you, Dr. Mubashir. Do you hear the advice? I hope it is very helpful for you in your future. Thank you.
Thanks.
Thank you.
Thanks.
Well, you know, many sites really we need just you know to spotlight on it, just try to make it very clear. The community and actually have a very profound, effective role in this track in health education. Okay, how do you describe also from your career? How do you describe the habits and the behaviors that come out from the community in this track?
Attitude, habits of community, of course, is usually you could prescribe it to the patient, of course, if he's from rural or is he from urban area, and according to the age. Of course, university graduate is very different from illiterate patient, and any doctor need to equip himself with the tools and skill to manage each patient and to talk as you could say as his level of talking, and to try to deliver the information that you needed for him to deliver. You cannot talk with everybody with the same language and the same mentality and the same intellectual level, and so it's kind of very important skill. You usually people either being educated about it. A medical health educator and health professional should be educated about it. But of course, education about it for medical students usually come from their practice in hospital with the patient, and to try to learn each part of tradition, especially in our country, which is a very large country with many community, many different culture and tradition. And so you come from here, you transport from here and there, and to try to pick up tradition and culture, to try to become close to the community that you are deliver service on it, so you could optimum your service to the maximum point. Because if you did not, the doctor cannot understand the patient, and the patient cannot understand the doctor, it will be a dialogue in the air with no any meaning, and no any result will come from it.
Well, you know, back to the traditional, because I'm really, there is some many people still believe in the social orientation in health education. And even one of the funniest things that I've met, me myself, I was a little close in part of time. I work for organization, and I had a chance to go outside, work in one of the countries. Really, they have a very nice way for helping vulnerable people, particularly that people who faces visual challenging. They just put out a bamboo, from a point with this very long distance up to the psychosocial reference in the health units. They just, because in the road and within the street there is many people, many cars, many things, just maybe get crashed or something like this. So they use this bamboo in very nice way, and come to the health units, not just for receiving treatment, even for receiving information about the health education and so on. And really that was so exciting, and I believe that people should start changing their way of thinking about health education. They still believe in some manner, and that causes health problems.
Yes.
Particular some tradition here in Eastern Sudan, as a pregnancy you shouldn't eat eggs, something like
Of
this.
course, yes. Some superstitious, of course, about this type of thing is very prevailing in our country, unfortunately. And as I said in the example you just cited, it's the little thing that usually protect from the big thing. As the proverb say, cleanliness is next to godliness. Simple washing hand and preserve a good hygiene will protect the individual from all kind of disease, especially in our country, which is diseases are very simple. We are not talking here about cancer or AIDS or whatever. We are talking here about diseases of malaria or diseases of gastroenteritis, which is inflammation in the abdomen, which is a very diseases of hygiene, unfortunately, and not taking the golden rule of hygiene could cost a person his life, of course. This simple thing and being promoted in our community will make a huge difference. We are not talking here about large program, very small program, very small. And as the example you cited, which is a very creative way to help people, blind people or people with visual difficulty, which is a very simple, yet it has a huge impact in our community. And this little, I think, little idea that we lack here in our community, in our country, that would change the future.
Really, in every time you say this is very valuable information, in every time I believe that really prevention is better than cure,
Yes,
really.
of course.
And this is simple things, just to prevent yourself from such a disease like malaria or like a dysentery, what we call it in your
Yes.
field, tropical disease.
Yes,
It's just,
tropical disease.
it is very simple ways that you should just wash your hands and just try to be more keen about the hygiene, the self-hygiene,
Yes.
and really it's going to be better. We still have many questions, and I really feel it is so interesting. Okay, some people believe the media has a role. It is very essential in this issue, and even you mentioned that before. Well, what about the other way of methods, like a campaign and just try, and also to transform from you as a doctor and also as a medical worker, you work in this field. Definitely, you've been in different kind of communities and different. So, just let's have your impressions and which community that you work in, it was so easier for you to deal with it. As you said, communication between patient and physician or the doctor is quite important. So just from
Usually the community that has, as I said, university graduate are the easier. I usually talk in English and they will understand me without needed to explain what I said or what I have. Of course, but that also result in other difficulties in when you meet with someone who's very educated, usually he's equipped and well knowledge about thing, and so you must be very careful and must be knowledge yourself, or you'll get challenge other on the other side. Of course, for any type of patient, there is the advantage and disadvantage. But as a medical professional, you want the good for all your patients, whether they are rich or they are poor, or they are educated or illiterate, and you want to them the help. And the more they educated, you are very happy for them, because they are going to protect themselves, of course. And you don't see many university graduate or literate people who are getting sick much of the time, because they are usually well equipped to even cure themselves, which is could be problem in itself, but also it has its benefit. I want also to mention here about the habit and attitude in our community, that our community, which is lacking, which probably due to lack of resource, but also for knowledge, we don't have a balanced diet and eating habit, unfortunately, which is very important. You see in any kind of culture in Sudan, there is a dominant meal, whether it is in east, west, south, north, or the center. There's a dominant meal, and this meal usually does not have what all the nutritional needed for the individual, unfortunately, which is very important thing. And there is also not much superstition about some kind of meal that is better than other, which is also this problem need to be addressed.
It's just like you're telling me that it's not matching with the RDA. I mean, that is standard or indexes by the WHO.
Yes.
You know, there is a values of what do you call it in the nutritional values, like a protein, like a carbohydrate.
Which
there
is
a specific amount that you should
yes,
use.
yes, it's called the daily required amount of any nutrition value from the minerals usually, and carbohydrate, protein, and fats. Each of it must need it, but of course, if you excess in any type of it, it will result in, of course, dangerous and serious disease. Especially, and the most serious of it usually is hypertension and diabetes. Usually, malnutrition in Sudan, which is a very prevalent disease, is usually happening in the younger pediatric patient, and young sector of our community. It's usually due, and have seen from only the parent out of unfortunately of ignorance, usually only concentrate on one type of diet, because they say that it is very good.
You know, in spite that we have a different resource in nutritional, you know, different
Yes,
kind of food
of
is
course,
available.
of course.
Really, thank you very much indeed for your participation, and thank you very much indeed,
Thank you
ladies
very
and
much.
gentlemen, wherever you are watching us via this program. And don't forget to send us our comments, our ideas. It's very appreciated. As I said, even easily you can find us within Facebook, and also in Twitter, and also the special channel in the YouTube for the program. See you next time with a new topic. Bye bye.